Briefly, for those that don't know, rheumatoid arthritis is the most popular type of arthritis. It is a continuous inflammatory disease. This means that your own immune system invades your joints in the body. This can lead to pain, inflammation, swelling of the joints, muscular tension, weakness, abnormality, and loss of flexibility. This is because the tissues in our bodies are very vulnerable to being infected. Tissues such as the blood vessels, lungs, heart, skin, and muscles are all very vulnerable. It was discovered that more women are infected by this arthritis compared to men, and it usually builds up in middle age. Did you know that there is more likelihood of you having arthritis if someone close to you has this disease, especially a family member? Now that you know the meaning of rheumatoid arthritis, let's discuss the causes. Don't forget to share your thoughts on rheumatoid arthritis in the comments section below. Just a heads up, the causes of arthritis can get a bit complex, but stay with us because we will explain everything in as simple words so everyone can understand what causes arthritis to be better able to fight it. Let's start off with the immune system. In every human, the work of an immune system is to make antibodies, which in very complex words are known as immunoglobulins. These immunoglobulins, or antibodies, are protective proteins made by our immune system. The purpose of these immunoglobulins and antibodies is to attack intruders in our body like viruses and bacteria. But in an autoimmune disease, like rheumatoid arthritis, instead of attacking intruders, your immune system attacks itself because it wrongly thinks of your healthy body tissues as intruders. When it attacks these healthy tissues by wrongly thinking of them as intruders, the immune system lets out chemicals that cause inflammation. These chemicals directly attack your joints and joint fluids. Now, because your joints are under attack from these chemicals, your joint area starts to experience ache and fragility. It becomes red and bloated, making it hard for you to move your joints. Now let's talk about the symptoms of rheumatoid arthritis. Let's be real, there are many symptoms. Even though this disease is capable of showing different reactions in people and can change from day to day. But we have handpicked a few of the top symptoms which we think you should be aware of before you can fight rheumatoid arthritis for good. These common symptoms include: number 1, fatigue. This is the first symptom that might show up before the inception of other symptoms, which can take weeks or months. Fatigue will make you feel extremely tired before the other symptoms become apparent. Fatigue isn't stable, as it tends to come and go from day to day or even week to week. It sometimes comes with a common perception of depression or ill health. Symptom 2, morning stiffness. This is the first and most obvious evidence of arthritis. As the name implies, it is a common form of arthritis that you may mostly experience in the morning. This stiffness doesn't last for long, but is often a warning symptom of arthritis, meaning that this morning stiffness might become worse if not treated properly. On the other hand, stiffness that stays for a very long time, like several hours, is always a symptom of inflammatory arthritis and is usually rheumatoid arthritis. But don't mistake arthritis stiffness for normal stiffness, which anyone can experience after a long period of inaction, such as sitting or taking a snooze. The symptom 3, joint stiffness. This is an obvious one. Having stiffness in one of your smaller joints is a usual early indication that you may possibly get rheumatoid arthritis in future. These types of joint stiffness can turn up at any time of the day, and it doesn't matter if you are active or not. More often than not, stiffness starts in the joints of the hands. This arthritis stiffness mostly comes on gradually, even though it is capable of developing suddenly and acts on multiple joints in the space of 1 or 2 days. Symptom number 4, feeling sharp joint pains or tenderness. Commonly, it is joint pain or tenderness that follows after joint stiffness, and this happens during movement or while resting and can affect both sides of your body. In the early stages of rheumatoid arthritis, the common location for pain is the wrists and fingers. This can also be felt in some other parts of your body too, like feet, shoulders, knees, or ankles. Symptom 5. Minor joint swellings. Mild inflammation is always associated with the joint pains and can make your joints turn out bigger, which isn't normal. These swellings are what we call flare-ups. These tend to last anywhere from few days to weeks. But the period these swellings last for can in fact extend with time. Symptom 6. Fever. An ordinary fever might come into play after symptoms like joint pain and inflammation. This is an early indication that alerts you of the possibility of upcoming rheumatoid arthritis in your body. But note, a fever that is higher than 100 degrees Fahrenheit or 38 degrees Celsius might be a sign of some other type of infection or disease. Symptom 7. Decrease in your range of motion. The presence of inflammation in your joints will make your tendons and ligaments weak and unstable. As the disease keeps growing, you might find it so difficult to straighten your joints or even bend. Symptom number 8. Numbness and tingling. Your nerves might go through some pressure created by the inflammation of tendons. This may bring about tingling, numbness, or what is known as carpal tunnel syndrome, which is a painful sensation in your hands. The joints of your hands or feet may even produce a squeak or crackling noise because your damaged cartilage is now grinding against your joints when you move. When broken cartilage rubs against joints during movement, the joints in your hands or feet might bring about some squeaky and crinkling sounds. Besides these 8 symptoms we have shown you so far, other early symptoms that you can experience during early stages of rheumatoid arthritis include prevalent weakness or a feeling of malaise, dry or inflamed eyes, dry mouth, eye discharge, sleeping difficulties, chest pain when you breathe, loss of appetite, hard bumps of tissue under the skin on your arms, or loss of weight. Now that we've discussed the symptoms of rheumatoid arthritis, we must talk about the fastest and best ways to get rid of this chronic disease. Like us, this may be the part you had been looking forward to. As we said, rheumatoid arthritis is a chronic disease and must be properly checked. Though more research is needed to fully treat this disease, we must admit that there is no permanent cure for rheumatoid arthritis at present. For now, the best you can do is to slow down arthritis development using methods we will show you today. So as promised, here are the top 8 remedies that can help you slow down and get rid of rheumatoid arthritis as fast as possible. Starting off at tip number 1, sleep more. One of the most important remedies for rheumatoid arthritis is quality sleep. Those who are experiencing arthritis need to prioritize sleep. This is because a research in 2018 found that lack of quality sleep has an impact on the amount of pain you feel and the strength you have to move around. As a general rule, make sure you sleep for at least 8 hours every night. You can take a nap in the afternoon if you're unable to get quality sleep at night. If you think you are going through any kind of sleep disorder, make sure you visit your doctor for solutions and treatment. Tip number 2, exercise. Exercise is as important as sleep. Regular exercise will help you strengthen your muscles and increase your joints' range of motion. A 2014 study on people with rheumatoid arthritis concluded that regular exercise is crucial if you want to enhance your sleep quality and reduce fatigue. But be careful to select exercises that won't tense up your joints. Exercises like swimming, fast walking, and water aerobics are all good choices that won't stress your joints. Resistance training, for example resistance bands, can also be helpful in toning your muscles. As we recommended, stay away from high-impact sports like tackling sports and watch out for your joints when they are still tender or critically inflamed. If you can't practice low-impact exercises on your own, then we recommend you see a physical therapist that can help make a customized exercise plan specially for you. Tip number 3, have a massage. If a professional massage isn't an alternative, then you can always work on self-massage. It will be a plus if you have a partner or friend who is willing to offer you a massage, because it can greatly improve your arthritis symptoms. In 2013, a study found that after 1 month, people experiencing rheumatoid arthritis who had regular massage had less pain, extra grip strength, and a greater range of motion than those who did not have massage. In case you are feeling any pain during your massage session, make sure you inform your therapist so that they can do some modifications. Tip number 4. Deep breathing. This is a straightforward tip. The last thing you want to do is further stress your body and joints. This is why the best solution you can try anywhere and anytime is deep breathing. Simply to take a deep breath in and hold for 5 to 10 seconds. Then exhale through your nose. If you want a full guided breathing session, then we will leave the link to Wim Hof's breathing session in description box below. Tip number 5. Try attentive meditation. Attentive meditation is a careful examination of your body movement, breathing, emotions, and feelings as they come and go whilst you sit down quietly. Frequently practicing this meditation can help people with rheumatoid arthritis to relax and better fight pain and other symptoms. A study in 2018 discovered that people experiencing rheumatoid arthritis who tried out attentive meditation were able to significantly improve their health. Another study carried out in 2020 showed how meditation can lessen the severity of pain, depression, and other symptoms of rheumatoid arthritis. But note, sitting in one position to practice mindfulness meditation can be in fact painful for those with rheumatoid arthritis. If that's the case with you, then be sure to talk with your instructor about modifications to help you be comfortable. Moving on to tip number 6, try hot and cold treatments. Put an ice pack to swollen joints to help reduce swelling. The use of cold temperatures can also help to lower pain and relax muscle twitches. As suggested in a 2013 study review, the use of cold therapy or cryotherapy can lessen pain in people experiencing arthritis. Also, make use of a hot shower or warm bath to smooth down your tight and achy muscles. You can also apply a heating pad, hot towel, or hot pack to help ease off tight muscles and reduce stiffness. Tip 7. Have a go at topical products. Stick on patches and gels or creams that can help reduce the pain in your muscles or joints. You can find these medicines in a pill form as well. What these ingredients essentially do is rub your nerves to suck out pain. And finally, tip number 8, eat healthy foods. It is important to eat recommended foods that contain good nutrients and have a balanced diet. This will not only keep your health and wellness up, but also help you maintain a healthy weight. Even though rheumatoid arthritis can be painful and reduce quality of your life. But by trying out these simple 8 remedies, we are sure that you will experience relief from rheumatoid arthritis to some degree within 1 month. For more videos like this, make sure to subscribe, and we will see you in our next video.